I'm Valerie Hall, certified professional midwife, licensed in Idaho and Wyoming.
My name is Michelle Bartlett. I'm the owner and administrator of Agape Birth Service, and I am also a certified professional midwife.
And we're here to talk to you about emergency childbirth. What to do if the baby is coming now and you're not going to get to help.
The first thing to always remember in an emergency childbirth situation is stay calm. We cannot overemphasize this point enough, and we could probably say it 10 times, and it's very difficult to do in an emergency. However, it is vital to both mother and baby.
That's right. If the atmosphere gets too nerve-wracking, the mother could bleed too much, many things could go wrong. Birth is a normal process. Births that are happening so fast that you're not going to get to help are almost always uncomplicated.
This is true. So the very first thing that you want to do is, as soon as you know that the baby's coming now and you don't have time to get to help, is get your room warm. Try to make the environment as warm as possible. A warm environment and a warm room keep the baby from being stressed.
If you're in a car, crank up the heat.
If you're at home, try to crank up the heat, or at least try to grab extra towels and blankets as soon as you can.
And if you're in a car, pull over. Do not try to speed to the hospital. The mother and baby are in more danger from a car wreck than they are from the birth. So, crank up the heat, protect the environment so that you have as clean a surface as possible. If you have a blanket or a sheet or a towel or anything that you can place under the mother, go ahead and do that.
Exactly. So make sure you have good lighting. You want heat, good lighting. You're going to stay calm. And really after that, there's really not anything to do until the baby is born. The mother does it all. There's no tugging. There's no pulling. You don't need to do anything other than to encourage the mother, smile a lot, tell her everything's great, and that she's going to be great, and don't do anything until the actual head is delivered.
Now the mother may choose any number of different positions in which to give birth. Don't dictate to her how she should be. She does not have to lie down. It's better if she doesn't. She might kneel, she might squat, she might sit. All of those are good positions for giving birth. Her body knows what to do if you don't interfere.
Exactly. However, if the mother chooses an upright position, if she chooses standing, be sure that you have something, a pillow between her legs or something to support the mother and make sure that the baby doesn't get dropped. So if the mother's in an upright position, make sure that the baby's going to remain safe at the delivery.
Because they are slippery. So there may be a lot of fluid that comes out with the baby. So the baby has come out. The first thing to do is hand the baby to the mother. Try to get the mother into a comfortable position. Put the baby on the mother's chest and grab something, your best coat if that's all you've got. A towel if you have it.
Rub the baby.
Rub the baby. Get the baby dry. You can dry off the baby's head. Just doing that is enough to stimulate breathing. Babies don't always breathe the very second they come out. Give the baby a second.
You always wipe the mouth of extra fluids. If you see extra fluids in the baby's mouth, you want to wipe the baby's mouth to make sure that there's not anything occluding the baby's breathing. And always remember, most normal newborns, when they are born, are almost like a purple blue, like a blueberry. That is all normal, and it takes sometimes several minutes before the baby turns fully pink.
But meanwhile, remember the baby is getting some oxygenation through the cord, which is still usually pulsing for a few minutes. So don't cut the cord, don't clamp the cord, don't do anything at all until you get to help. Keep mother warm, keep baby warm. If you have something there that you can give the mother to drink, like juice or something like that, that can help her not get shocky. But basically, that's it. Common complications that can occur are that the baby does not want to breathe or that mother bleeds too much. The baby will usually begin breathing with some stimulation and being kept warm. The mother bleeding too much is impossible for a lay person to assess. The worst hemorrhages generally don't begin to occur till about 20 minutes after the birth, and by that time you should have the paramedics with you.
If baby's not breathing, you give the baby, you're looking for a baby that has some type of muscle tone and is making some effort. If you deliver a baby that is pale and limp and is making no effort to breathe, then the first thing that you need to do is do inhalation breath. So you want to give the baby one good puff of oxygen from your mouth. And you have to be careful, because if you overinflate a baby's lungs, that is just as dangerous probably, or more dangerous than the baby breathing, because now you have two problems. However, you must oxygenate baby's lungs. We would recommend that you call 911 in this situation if you haven't already, and discuss with them and let somebody talk you through this over the telephone, because it can be managed with good coaching over the phone. Yep. We say birth is natural, it's normal, and a special event. Sometimes the baby's just in a hurry.